here at day 1. We just come from Dr. That I saw mine.
So this is the warts and all version of Douglas's next journey, which is the bone marrow transplant, which is scheduled for the 3rd of June. Starting the 3rd of June. So we've come for a big lunch all the way to Darling Harbour. There is nobody in the city. COVID has killed the tourism, which is great because we've got a nice quiet restaurant, believe it or not. And Douglas will now get the view. So while he's taking the view, I'll just tell you all the details. So he has to go for a lung function test on the 18th. Got that wrong, it's the 17th at 3 p.m. We're waiting for an appointment for the bone marrow biopsy, and we have to have some chat with a consultant. Otherwise, all systems go. 3 June for day 0 coming up on the 10th of June.
So there I am, I'm perfectly healthy at the moment. But I signed all my forms away and signed all the consent forms this morning.
Alright, so now going on to this list, it contains medicines to help prevent you from getting infections, and also contains other medicines, supportive care medicines, and most importantly, your chemotherapy tablets.
Yes.
In preparation for your treatment. So the first one here is a medicine that's called Respirant Fort, otherwise known as Bactrim.
Right, okay.
And it's an antibiotic.
Right.
Basically, we would like you to take this one tablet twice a day. So take 1 tablet twice a day, morning and night, starting from Thursday the 3rd, to prevent chest infections.
So we'll take that as soon as I get home.
So basically, you don't have to worry about the breakfast dose because it's already afternoon.
Correct.
You can continue, you start taking on the dinner, so tea is dinner.
Yeah.
And then just keep taking it twice a day until you come to the hospital.
Okay.
Including on the morning of Monday.
Correct.
When we come in. Okay.
Because I said I need to take my tablets at 5:30 in the morning and then fast. So that's no breakfast.
Correct, but you can take your medicines with small sips of water.
Okay.
You guys from South Africa?
Yes.
I'm from North Africa,
Okay.
Oh, well, there you go.
Egypt.
Oh, right,
okay.
yeah. Opposite extremes,
Yeah.
eh?
Alright, so basically, this medicine is to help prevent you from getting chest infections. It's best taken with food,
Yes.
and will make your skin a bit more sensitive to the sun. So
Okay.
be aware of that, so you can wear. I mean, it's winter anyway.
Yeah, we'll be right.
We
There's
don't
no
have
sun
sun, we
today.
don't have sun problems at the moment.
And then the second one is also the oxalic acid. It's a medicine to help protect your liver. We want you to take 2 in the morning and 2 at dinner.
Right.
And it's basically the same as this one, because you've missed the morning dose. You can just start on the dinner dose.
Yeah.
Take 2 capsules twice a day,
Right.
morning and night, starting from Thursday the 3rd, to protect liver.
Right.
Okay.
Huge.
Yeah. Yes.
Yeah.
You've got to get used to taking tablets.
Yeah.
I'm quite used to taking tablets, believe me.
The nizatidine. Now, nizatidine is a medicine that we give to all of our patients to reduce the stomach acid and reflux. Since you're already on period, it's not necessary that you on nizatidine for the period before transplant. However,
Should I not stop period and take that instead?
you could do that. Yeah.
And that way we completely on your
You could do that.
profile.
You could do that. I was going to suggest you could continue taking with the period and not worry about this one until you come to the hospital. And then when you come to the hospital, we can cease the period because it interacts with one of the medicines.
I'd rather just move across to that.
It's
and
not
stop
as strong
period.
as a period.
But that's all right.
Yeah.
We'll see how we go.
Okay. So one capsule at night starting from Thursday
Yep.
to reduce stomach acid.
Okay.
Itraconazole, it's a medicine to help prevent you from getting fungal infections. We want you to take 4 in the morning and 4 at night.
Okay.
Oh, crikey. Okay, those are big ones, yeah?
Yeah. But they're so easy to swallow.
To take forward. Yeah, okay, fair enough.
4 capsules twice a day, starting from Thursday. Again, you can start on a dinner dose to prevent. I'm reading it upside down. Antifungal to prevent to prevent fungal infections.
Yeah.
Okay.
Now, the last 3 ones. First one here is on ondansetron. It's to help prevent nausea and vomiting. So you can start that taking from Friday the 4th to prevent nausea and vomiting. 1 in the
So
morning,
that's
1
from
at night.
tomorrow, yeah?
Correct. And from tomorrow also, you'll be taking your fludarabine tablets. And to basically says you can. So for regarding tablets, from tomorrow we would like you to take 8.
8 tablets.
Correct. Take 8 tablets daily starting from Friday the 4th, chemotherapy.
So that's 8 all at one time.
You could do that. Or you could take 4 and then a couple of minutes later you can take another 4.
Yeah.
As long as you do it in a short amount of time.
And it doesn't have to be done during meals or anything like
No,
that.
just in the morning.
Yeah, okay.
I've divided each 8 tablets in a separate box for you so you don't have to count 8 tablets.
Yes.
Okay. Good.
And I've given you the Bite mouthwash.
Okay.
It's good to keep doing that. 10 mils 4 times a day just helps with mouth hygiene.
Okay.
Yep. So basically you keep taking all that in addition to the allopurinol, the GAP tablet.
Yes.
And the
Okay, welcome to day -6.
This is the first day on chemotherapy drugs. I'm taking 24 tablets. And at the moment I'm feeling just fine. I have no side effects from the tablets as yet. So day 1 of a long journey. Good morning. It's now day -5, Saturday morning. I'm on my second day of chemotherapy drugs. And I still feel good, which is fantastic. So I've just had all my tablets. I'm on 25 tablets a day. And I'm just finishing up my wheat packs and going to have some coffee. Bridget's just brought me back a nice takeaway coffee. And
Yay.
see what the day holds.
Yay! And what's your plans for today?
I'm going up to Dermot's house to help load the skip. And
No, to watch load the skip.
To watch load the skip and put a door in.
Yeah. Okay.
Here we are, we've just come out of day surgery to have a central line put in my neck. And I've got to wait to get a bed so I can go into the ward where I have all the rest of the drugs. At the moment, apart from a hole in my neck, I'm feeling pretty good. So, this is Monday. I'm still waiting to get into the hospital bed. Apparently it's only going to be ready at about 4 o'clock because I need to discharge somebody. I've been at day surgery most of the morning, sitting there passing time until they could put this line in. So you can see the line in me over here. So that's what's basically sticking a big needle into my main artery and then having a couple of other lines. So that's how they're going to feed the rest of the drugs into me moving forward. So yeah, it's a day of hurry up and wait.
Righto, it's Monday evening and it is 4:25.
We're in our hospital room, which is a nice room with a view of the CBD of Sydney. My central line was put in today and it's just got all that packing, it's very tight and it's bruised and it's just a little uncomfortable. I mean, it's not painful, but it's uncomfortable. And so yeah, otherwise I'm feeling well. Probably a little tired from a long day because I haven't really slept today. I'm just sort of had a little waiting game in chairs and stuff like that. So today was very much a waiting game. Hurry up and wait. But I'm very pleased that I'm settled now. In a nice room and had some juice and had some lunch and I'm feeling a lot happy.
Room 11.
Room 11. It's now Tuesday. It's my second day in hospital. I got in late last night. I had a reasonably good night's sleep. It's very peaceful and quiet. A bit of a sore tummy, but other than that, I'm feeling reasonably well. Had some breakfast, some more tablets, and today is to have a whole lot more infused medication with the chemotherapy. And yeah, so next couple of days I have chemos and hopefully not too many side effects, and we'll see how we go. Hello, it's afternoon of Tuesday. I'm now on chemotherapy infusions. It's going through on the machine back there.
Melphalan.
I'm having to eat ice blocks to keep my mouth cold, try and stop all mouth sores that the chemotherapy causes. And at the moment I'm still feeling okay. Long may it last. Let's see what some of the other patients look like. Not looking forward to the future.
Oh yeah, but the big future, not the near future. Yeah. Okay.
Good morning. It's now Wednesday, the 9th of June, which is T-1. Fusion goes in tomorrow. I was on drips. See the drip mechanism here next to me, with all the drips up top there. I think they go on top like that there, can't see it. And yeah, I was on drips for basically 12 hours yesterday, with different stuff going into the system. And it only finished up at 4 a.m. The last drip was taken out, and I make a bit of a noise, so sleep wasn't that fantastic really last night. I have to catch up with some more sleep today. So I've got drips in the moment which are anti-immunity suppressants or something, so it's trying to knock my immune system out. And then I had more antibiotics. I had all my antibiotic tablets. And yeah, at the moment the process is just to kill my existing system and manage the side effects, and so far so good. I've just had my breakfast and morning tablets and all's going well. So apparently the drugs today are going to make me feel very lethargic and lazy. So I thought I'd do a video this morning while I'm still cheerful, even though I'm probably feeling a bit of lack of sleep. But all in all, it's all going very well. It's really all a bit daunting, I've got to tell you, because they're progressively knocking off my body, going to a point of no return on Thursday, where my immune system and my bone marrow is dead, and I had somebody else put in there, and we hope to then recover from there. So I'm told that following Thursday, Friday, sometime next week, is when I should be in the most pain and suffering and getting through rejections with all the side effects. But right now, I couldn't be pleased with the process. It's been very straightforward. And the central line is sort of eased in. I don't notice it there much at all. So I think as systems go, it's a fantastic system, because I had well last hospital treatment. I had nurses trying to put needles in my arms the whole time, whereas the central line, they just connect to it. Good morning. It's now Thursday, the 10th of June, 1922 or 21. And it's the day 0 when I'm supposed to have the official infusion of the donor's bone marrow. So I was on strong antibiotics yesterday with anti-nausea tablets and a whole lot of other tablets that made me a little bit dopey. So I ended up having a very good sleep last night. I'm still getting fed well. I can walk around. And today I want another intense dose of antibiotics in the morning. I'm also on some anti-rejection drugs, so that when the donor's infusion comes in this afternoon, there's no too big a fight between the system. Apparently today should be a bit of a so-called letdown, because all the infusions go in and the blood donor goes in, and then I get on to 24 hours worth of drips that are just like saline drips to keep the system going. So they've putting a lot of drips into my system, but my side effects and all that supposedly maybe nothing. There's fears of fevers and other problems that could occur, but that hasn't materialized. So from day 7 to day 1, or day 0, which is today, I've actually had a relatively straightforward time. The daunting part was getting this line full of my neck at the time. Of course, that was, I wouldn't say intense, it's just that the intense waiting game of getting there is always a problem. The actual procedure itself maybe wasn't as bad. And then once I've received myself to the hospital room and settled down, it's all been very comfortable. Like a little room in the CBD harbour that I can look out, but not really expected to go further than around the ward. And the room's all designed with positive pressure, so every time you go out the door you can feel the pressure going out with you, so it prevents any infections from coming into the room. So this is the view from my bed. I was lying in bed until they came and took my breakfast order. So on the far wall there, they write up what my bloods are for the day afterwards. They take bloods every day. And the main wall here, they are taking a note of what I want today. So Rachel's my nurse again today, and they're basically going to put in the stem cells and the VH Marrow at 1530, which is actual stem cells, amongst a lot of other things. So that's my view outside. I just took the clip off so I could move my drip around with me. That's the inside of the bedroom. All the other stuff that goes with it. And this is the beautiful toilet that they provide with us. So I've already had a morning shower, but it's a very nice toilet designed for disabled people. The shower actually works really well. And then we go. It's tiles similar to what we have at home. So we have a very clinical toilet at home as well.
Just going to attach your line so that we're ready to go when the cells are thawed.
It's all about to happen, so with the help of God and all his angels and saints, we'll get through this. And then we're sailing around the world.
Good on you. I have no bone marrow about them, it's all been deleted. Immunities are down to very low. I'm in this room which has got positive air pressure, so the flow tends to flow out the room as opposed to accumulating in anybody's mouth. And they're all busy unpacking my bone marrow stuff outside. Here we got the team of nurses outside defrosting my marrow. So we're going to bring it to the room any minute now and connect up.
They're outside preparing the cells, thawing the cells at the moment. They should be in quite shortly. Apparently it's a non-event, but I don't feel a non-event happening.
There you go. Kids think it's a non-event. For the wall.
As well, it's the worst time. And the cells, this is a weekend in July. Alright, what is your name?
They're both happy for you to keep
Yeah,
the
that's
camera on.
fine. That's all good. Can you just tell us your name and date of birth, please?
It's Douglas Campbell Sermon, 3rd of the 962.
Perfect. And your MRN and your thing, can I read that out?
What's it? What's it got such on?
6220672. Perfect. 500 miles an hour? Yep.
The blood cells are on the other side now, Douglas.
Alrighty, this is them. Turn your
Go
camera.
in there.
Did you want to be in the picture?
Well, the idea is to see how badly deteriorated I get.
It's your big day. Alright. That's them. Starting, what's the time, Tim?
206.
Perfect.
Good.
That's all
500.
good.
It's as simple as that.
I'll just keep this on, say 15 minutes, we'll just make sure that you're all good. Let us maybe start to feel that itchy throat or any changes at all.
Anything else, Jade?
No, these will run for a few minutes and then I'll just grab whoever's free to check the next bag. Thank you.
So there we have it, my first set of new German bone marrow skins put into my system based on the assumption that the old bone marrow is sufficiently deteriorated or destroyed and that this new bone marrow will ride over it. And that's that.
Understand? I'll just flash back. Just make sure we get every last bit of the cells. Alright, try not to have any ice for the next little bit, just so I can get your temps under your tongue. All your obs look stable though. Okay, ready?
Okay, we're getting ready for the second bag to come through now and be attached. At the moment they're flushing the first bag, so they get rid of every little stem cell they can into his system.
Yeah.
Today is day 1.
Day 1, so day after the bone marrow has been inserted. I've been on drips all night. A lot of them are drowsy drips to prevent me from being nausea and having all the other chemo negatives which I haven't had so far. So I had them going squeaky all night, which has never been too good, but they're making it drowsy. So I'm feeling well. I'm not eating as well as I should be. I struggle to swallow bits of food, but my systems are still working well, and I go off to the toilet and I come back to bed. And I sleep.
Okay.
It's some total of my day at the moment.
So now that you've told me that, then I think when you wake up from your next little nap, you should have that Ensure, because it's nutrition, easy to swallow.
Potentially I can have something like that, yeah.
Yeah.
Let's see what they have for lunch.
Okay. See you later.
Okay, bye-bye. Good morning. We're now on Thursday, 13th, so this is day 3 or something. I had a reasonable night's sleep. I had meds on all night, or drips, and then taking them tests throughout the evening, but I must have been a little bit drugged as well, so I slept on and off quite well. It's now 7 o'clock in the morning, so I decided to get up and have a shower and change from the jobs I took this morning. Breakfast should come in at about 7:30 or more, and then I'll have some more to eat, and then probably lie down back in bed and have a rest. So my current feeling is one of, I guess I have a slightly thick head, not 100% clear. Energy levels are not too bad. I mean, I got up, had a shower, ate some oranges, and yeah, got some of my clothes on and gonna have something to drink and eat and see where the day leads me. Here it's Saturday, 2:12.
Day 2.
Day 2. Just having medications, not as many, but feeling a bit lethargic and restless and just lying around in bed doing nothing. Bridget's came to visit as usual, been looking after me, but
Doing nothing.
not much. Yeah, what you have to say?
Oh, I've got a lovely spot here in the corner, looking out at King's Cross in the sun, reading my Kindle. Not much happening, which is probably good. Resting to get well. So day 2, and they've just inserted the nasogastric tube, which was quite an uncomfortable process. The idea behind this is that they expect mucositis, which is little sores in your throat and mouth, and so they'll need to feed you, and the better way to feed you is through this tube rather than through the neck. So we've gone for this option, but right now we might think otherwise.
Well, right now we are thinking otherwise.
But apparently you can get used to it over a day or two. Let's hope so.
This is Sunday morning. I just finished having breakfast. I put some feeding thing down my throat, which is a pain in the ass. I don't think I need it right now. I can eat normally, but it just gets in the way. So we're on Sunday morning. I'm still alive. Funny dreams at night. I'm a little bit tired. But other than that, I think I'm fine. I'm not in any pain or anything. We just carry on. Here we are on Sunday afternoon. I just got out of bed and had a shower and changed of clothes. Bridget's bought me a new selfie stick, but I haven't quite figured out how to turn it on remotely yet. Got a Vivitar tracker or something. But all in all, I'm feeling quite lethargic today. And I've got this silly tube up my nose, which I haven't found need for yet, but they're anticipating that I'll have difficulty needing it. I should put it in now before it gets terrible. So, watch all I've sort of been sleeping and dozing and acting miserable already. My darling wife's been looking after me as usual, sitting in the corner, looking after me, bringing me my food.
Here we are, day 3, and Douglas is feeling zonked.
So Easter Monday. I've got Bridgie videoing me because I'm just too miserable to do it myself. What's wrong?
Day 4.
Day 4. I'm feeling miserable as hell. Uncomfortable. With a scratchy trip in my stomach. And a sore tummy. And all in all, I'm over this now already. Thank you very much. I'd like to check out. Oh, finished. This is Tuesday, day 5. My white counts are down to 0.01. I'm feeling lousy as hell today. And apparently I've got another 5 days of this plateau of feeling a miserable little old sod. And it's like different pains, like stomach pains and chronic pains, and sleeping and diarrhea and sore bum. So you want to list it? I'm going through it. Yeah. This is what you do for the sake of bone marrow biopsy. Until another day. Day 16. I'm starting to get throat ulcers. I had a terribly painful night last night. And I think I was just hungry. And managed to have my breakfast this morning. Now another methotrexate dose. Taken all my tablets and had some diarrhea tablets. And yeah, another day of feeling absolute misery. So there we go, day 16.
You're on.
Today is day 6. It's been a roller coaster of a day because I started getting fevers, hot chills, and then cold chills and hot sweats, and now put me on not steroids, on antibiotics and painkillers, and my white blood cells are down to 0. So all in all, it's been a very rough day today. That's it.
And that's it. Rough in terms of temperatures, chills, the shakes. Now he's having some yogurt
Tummy.
and receiving some red blood cells today, which apparently is supposed to help with the energy. Here we are, day 7. Douglas has been in ICU since last night and hoping to go back to the normal ward. His heart rate has been playing up.
It was a very traumatic time in the heart rate spot, but intensive care had managed to give me drugs to bring it down again, and they're giving me some extra bloods. And it's now stabilized. It's still beating it, but 100 110,
101 at the moment.
varies, but at least it stabilised, it wasn't spiking. So I spent last night in intensive care, and with a bit of luck I'll be going back to the ward again this afternoon to hopefully carry on this mammoth endurance trip.
This is day 8,
Go for it.
and we're about to be moved back to the ward, which is good news.
I've been in intensive care for 2 days, and we had heart palpitations, which is the main one. But it was all just pretty rough and ready stuff. And now I'm stabilised, so I should have gone back yesterday, but they couldn't have any beds available. But I'm now going back to level 9, which is the TB transplant ward. And I've actually got a bed available.
Okay, cheers.
I'm just tired and lethargic.
And you're on.
Now it's today, 19th of the 6th, day 9. This is a day of no energy. They're supposed to be giving me an ultrasound. I decided to wait on feeding and things, but of course everybody's too busy for ultrasounds. And so I feel like I've just lost at sea. I can't with no food. Just having to sit around waiting. But I'm feeling a bit better because my darling wife, Bridget, keeps coming to look after me. And now they've decided to give me some food, so hopefully later on I'll get a bit more energy. But right now, it's like exhausting just having a wee in bed. It's as bad as that. But I still have my humour and my darling wife. So we press on until another day. Anyway.
Okay, June, Sunday 20th, day 10.
20th of the 6th. So we still becalmed at sea, if I can use the word. Nothing's happening really apart from just the effort of living another day. And I've got to manage high blood sugars now, what they call it.
High blood sugars, diabetes.
Diabetes all of a sudden. So all my favourite chocolate milks and things I drink, I can't drink anymore because just blood sugars are too high as a result of some other medications. So now I'm on a feeding drip and I can drink a bit of water and lie in bed, and I've just come back from a walk halfway down the corridor and back, which was very exhausting. So, what do I say? Get this whole business moving along. I'm tired of just sitting in limbo. But I've got 10 to 15 days of limbo. So, I've got at least another week of this before we should see any upward improvement. Which is very sad because it's quite boring and annoying. It plays with your mind.
All right.
But lucky I've got Bridget to look after.
Yeah, live in hope. Live in hope.
Yeah.
That's what we're talking about. Bye-bye. It's day 11 and we've just had the numbers written up on the board. I must say, I was thinking we were just being abandoned because yesterday wasn't filled in at all. It was 3 o'clock before they did them today. Anyway, there they are. Very low, so we're waiting on a cross match, whatever that means. And then he should get red blood cells and platelets, which are at an all-time low of 6. Nose is bleeding quite a lot. Weight has gone up 0.9 since yesterday, so he's feeling very bloated. And hemoglobin is down at 68, so he's feeling thoroughly exhausted. Anyway, turning around, great view. And then you find Douglas Darling has just had his nose packing replaced.
Day 11 and I've got zero energy. I went for
Ultrasound.
ultrasound this morning and it just took everything out of me. And now I'm just trying to survive But all the doctors giving me everything I need. Excuse me. But it's, I say, another day in that dungeon doldrums, where there's no sign from the new bone marrow. The old bone marrow's already said, bye-bye Douglas, you're gone. And now I just have to hang in there and try and keep my head up and breathe and live another day until life can pick up. And needless to say, I'm just exhausted. I'm not even miserable. I'm just exhausted.
Okay, well here we go. We might check in a bit later when we get a bit more energy. Alright, second video for day 11. Check out all the stuff on the post now.
Yeah, all the meds planned for me tonight. It's now what, 5:30 on Wednesday evening. And I have to have all these meds infused.
Albumin going in at the moment, 2 bags of platelets, red blood cells coming, magnesium, antibiotics, immunosuppressants. All we really need is alcohol.
Day 12. So I've had a difficult little day with breathing today. And it's with hiccups, persistent hiccups. Yeah. Last night and today. And then we had a new line put in this morning. But it's still in the doldrums, waiting for the new bone marrow to do its thing. They're having to marry all these other problems. And today's problems is hiccups and breathing.
Are you ready? Go.
I'm on day 15, Friday the 25th of June, and I'm feeling a lot better. Still got a cough on me, okay. I've been having a bit of a higher heartbeat today, which I eventually took down with some medicine just now.
And it's up again.
Other than that, I was allowed to sit up this morning, which just felt so good after sitting up. And then I sat up and had all my doctor's checks and my medicines and everything. And I can't go walk about, of course. So I'm just going to sit and wait. And then in the afternoon, that I'm going to lie back down again. And I actually had a wonderful sleep as well. Although I have funny dreams. Obviously, you have funny dreams. And I'm just hanging out there that this bone marrow is chugging along, and we're just one step out of this misery hole into a good life again. Yeah, it's the 26th of June now.
Day 16.
Day 16, and my white cell count is up at 4.6. I've been in the last 4 days in intensive care, which has been an intensive rack with the amount of noise last night, with drug addicts and prisoners and other people who think they could have a bloody church service in the middle of the night, all around your beds, and no regard for anybody who's got to have a sleep. Anyway,
On a more positive note, we're back on the ward.
Note, I'm now back up down south. I've got half the amount of wires and cages and pricked and plugged into me, which I'm hoping is going to all transpire to a good night's sleep tonight. And then I'll be right as rain, ready to go home.
All right.
Or something like that.
Good night.
Bye. Sunday, 27th of July. I'm back in Ward 9. I had a nice sleep overnight and I'm feeling a lot better. I'm just sitting up in a chair now. I had a good bit of sleep, although I'm still tired. They've got the COVID shut down in Sydney, therefore Bridget can't visit me, or no visitors whatsoever. So I just have to make do with my own company today, which maybe I have to turn TV on or something. But yeah, I haven't had the results of any blood counts today, but they were up at 4.6 yesterday, and I think it's a good sign of recovery and the new bone marrow taking. And so, despite my weakness and lethargicness, I'm encouraged to think that this is all going to work out now. So let's do some physical exercise test that can remove my catheter, give me a bit more freedom. And all in all, I think we're looking up. Okay, chat to you later. Hello, it's now the 29th of June, and I'm getting stronger every day. White cells are now all gone up to 9.4, which is good. The doctors have just been, and I said there's definitely confirmation that the new bone marrow is taken and is doing its job, and that I'm going exactly according to their plan. So, with the hard weeks all behind me, a bit like I should have probably another week in hospital and then get sent home for longer term recovery. Problem is exhaustion. I get tired very quickly at the moment, and generally if I talk too much, I get into a coughing spree, which we haven't managed. Anyway, I'll show you the numbers now. So up there, the numbers on the board. So my platelets are at 46, which is the highest I've ever been for. God, I can't remember. And then the white cells are at 9.4, and I'm weighing 91.5 kgs. Okay, until tomorrow. Hello, it's now 30th of the 6th, Wednesday, and my blood results have come back, and white cells are down to 7.6. Apparently it's normal for them to fluctuate. Down to 91 kgs. So I've been losing a bit of fluids. Yeah, still probably the biggest problem is the frequency of urine having to have a weird night is still a pain in the ass. But I think I might be improving today because they're changing some medications according to something like that. But yeah, I ended up getting a good night's sleep. I had to take some Panadol for the pain in the ankles. But of course, after I woke up, the swelling had subsided and the pain in the ankles had got away now. But without that, I probably wouldn't have had a good night's sleep. Had my brickley and everything else, that's all been done. And yeah, so the doctors are going to start weaning me off the medication and basically plan for me to be sent back home, probably within the next week or so. Okay, that's today. Today's now the 1st of July, and my central line, they reckon, might have got infected, so I've had the second central line taken out. You see over there, and I have to go in tomorrow to get another central line fitted, so they really put you through the works here. Other than that, my bloods seem to be working well, which is an indication of the bone marrow working. And I'm feeling quite well, and I was walking around a bit. So hopefully this will mend. I'll continue to be on the mend. Okay. Today is the 2nd of July, and it's a Friday, and I've had a day of tests. I've had an ultrasound, I've had a CAT scan, I've had a scan of my heart, I've had scans of my lungs, chest X-ray, and what they've come up with now is that they think I've got pneumonia. So they're going to start treating me for pneumonia in my lungs. And my kidneys and liver are starting to struggle a little bit. So they want to reduce the medications to try and give them a bit of a rest. So that's another day in paradise, but I still certainly feel a lot stronger. I feel I'm getting better every day. But who knows how this pneumonia story passes over. Anyway, that's it for today. Hi, it's the 3rd of the 7th now, and it's a Saturday in the hospital. I'm feeling reasonably well, but apparently I've got excess, what was it? So I'm now being rationed to 1 litre of fluids a day while I'm on the antibiotics for the pneumonia. But I'm still in good spirits, and I've been getting stronger and stronger every day. So yeah, my blood counts are really looking good. I'll show you that now. And you can see it's really good. And there you can see the other thing, fluid restrictions. So another day in hospital, and you know, as you improve in your health, you realize how boring it gets in here, because TV's bullshit. Anyway, if I'm coughing, it means I've done too much talking already. Okay, bye. Hello. It's now the Sunday the 4th of July, and my blood's really stabilized very nicely. But unfortunately, I've got an excess of potassium in my blood now. So I'm still fighting pneumonia. And I've got this other thing I finally sorted out. I'm on fluid restrictions. Today is now 5th of July, and my blood seems to have all settled. So the doctors confirmed that the bone marrow has grafted nicely and it's doing its job. But I've got pneumonia now, of course, so that I've got to get rid of pneumonia infections before I can come home. But I'm feeling quite well and strong normally compared to what it has been the other couple of days. Right, today's Tuesday the 6th of July, and my blood levels all seem to be maintaining. The pneumonia is what's now holding me back in hospital. So tomorrow I go down for an endoscopy so they can identify the type of pneumonia, and then they're going to give us drugs to treat that type of pneumonia. And then they reckon, so this is a Tuesday, they reckon that tomorrow's Wednesday I do that. She reckons I might even be released by Thursday. Would you believe that? Fantastic news. It's now Friday the 8th of July. I'm now dressed up in my get up and go clothes because I'm finally being discharged from hospital. So the long journey of recovery takes place at home, and that's over the next 9 months or more. And I'm so relieved that I can now move out of hospital and go back home. And I've got to give credit to the hospital staff who've looked after me. The last few days, once I've recovered, it's been absolutely tremendous. Thank you. Day 33. Bridget's brought me the best present ever. A little table to eat my food out of, sitting at the chair. I'm at home now for 3 days, and I'm still getting stronger every day as it passes. And I can't say more in appreciation of my darling wife Bridgie for the way of administering all my medications. But it's truly remarkable how the recovery process works with this bone marrow. And that's, while I'm still fatigued for most of the day, I'm really feeling on top of the world.
Day 35. About to give these 3 Clexane injections, an 80 and 2 20s for 120 milligrams of Clexane, which is to thin the blood, because we just had a transplant to get platelets. Now we're thinning. Anyway, that's got to do with the heart. These are the medications we're given currently. This is today, page 1. The yellows are the ones that have already been given, and page 2. At the moment, the heart rate is 148, which is why we're giving the injections. Blood pressure was 109/82 at 9 a.m.
Can you also explain the fact that you're going electric shocks on Wednesday?
So apparently, this needs to be explained.
I've got a condition now where my heart is out of sequence. So apparently there's 4 chambers in the heart and they're all supposed to beat together. But for some reason my heart's now out of sync. So this side's beating and that side's beating. So as a result, it's ended up doubling the heartbeat count. And the only way to have this reset is to go in for day surgery, and effectively the doctors will go and put an electric shock on my heart to try and shock it back into the proper sequencing of working. And in the meantime, we have to take drugs to thin the blood, because the potential risk here is a very high risk of blood clot, which could lead to paralysis if we don't have it addressed. So today is Saturday, we're booked in for surgery on Wednesday. So we just have to make sure we survive between now and then, sort it out. And amongst all the other issues of diabetes and whatnot.
And here is the medicine trolley that we have in place at the moment. Ones on the top are sort of once or twice a day, mostly twice a day. The second shelf, the basket, is the diabetes medication, and the heart stuff is on the left. And then bottom shelf is pretty much new boxes of meds that have already been filled. This is our heart blood pressure monitor over here. And that's all I've got to say.
Hi, it's the 28th of November. And yeah, I've progressed well with my bone marrow recovery. As you can probably see, my hair's recovered a bit. So since the last take, I had the heart problems. Funny enough, on the Sunday, my heart basically got back into rhythm on its own. So I had some heart tablets, but I didn't have to go ahead with the heart electric pulse to reset the heart. Subsequent to the heart problems, I ended up having a urinary tract infection, which was really painful for 2 weeks. Subsequent to that, I had another chest infection and breathlessness. And I've been through a number of specialists, and that's all been cleared. And in essence, I'm really on the road of recovery, but the bone marrow recovery is just really a very slow process, and it's fatigue and trying to get the body back into fitness. So I created myself a little home gym that I try and use, a little bicycle and some weights and some walking machine. However, I've just got to measure myself, because while I'm actually, so much better than I would have been even before the bone marrow now, my fitness levels are still, I've got a long way to go. But all in all, I think I've proven to be a really excellent candidate with this bone marrow and the recovery process. Cyclosporin is the immunization drug that we take to try and prevent the graft versus host disease, and I've cut that down to 1 tablet now, and our doctor, Professor John Moore, believes that I could probably go off it at the end of the month, which is really quite positive news. So I guess I'm really on the up and up now, and I'm a lot stronger, and I'm back doing, at least a half day's work every day and fully involved in what we're doing. But the only challenge is the lethargicness and the tiredness and the requirement to have a sleep during the day. But it seems to be that all my graft versus host illnesses have subsided. The worst I have is Probably see on the side here, a bit of red on the face, and that's about the worst indication of my graft versus host at the moment. Other than that, it's just purely a fitness area, trying to get my lungs to breathe properly. And so, yeah, that's probably, I would say, the close of the chapter of the bone marrow recovery. And yes, I've still probably got another good 6 months to get fully recovered. But with regards to the experience of the bone marrow, you know, been there, done that, would never want to go through that again if I could avoid it. However, I still believe it was very much the right decision. And my platelet counts is over 100, which is absolutely phenomenal for me. I haven't had platelets like that since I can remember. And platelets really is the strength of your immunity and the strength of your ability to clot blood when having cuts or abrasions. So all in all, my bloods are really coming back to what a normal person's bloods would be, which is something I haven't had for over 10 or 15 years. So certainly the bone marrow has done the miracle treatment they claimed it would. I don't think anybody can really prepare you for the challenges and the difficulties in going through the procedure, but it's really just a procedure that one has to look at the long-term end goal and move forward with it. I need to obviously thank the support I've had in getting through this procedure. It's certainly not something one can achieve without a tremendous amount of support, and you know, primarily obviously my wife Bridget. Without her undivided attention and support, I could never have got through this. And then definitely to the Kinghorn Cancer Clinic and the doctors and the nurses who were involved. They've been extremely impressive, and you know, it really has been an education in how modern medicine, you know, they have a drug to address any issue that may arise, you know, whether it's urinary tract infection or lung infection or heart infection or whatever the story may be. They always seem to come up with something to be able to resolve the issue. So it's just so incredibly impressive. And you know, they gave you a roadmap of what to expect, and it's pretty much on the money, exactly what I've been through. Yes, you can never get prepared for the actual journey itself. It's an individual journey and it's tough, but certainly without the support of family and the doctors and friends, it would be impossible. So, you know, I dedicate this video to my wife Bridget, because without her, I would have really, really struggled. So, thanks for watching.